Good afternoon, ladies and gentlemen. Welcome to this new segment of Medcast. We are so pleased to have today Dr. محمد غالب الجازع, who is a senior specialist in pediatric medicine and specialized in respiratory medicine. Dr. Muhammad is a fellow of Great Ormond Street Hospital in London, United Kingdom. Welcome, Dr. Muhammad.
Thank you very much for having me here, and good afternoon, everybody.
We are so pleased to have you today, and we need to discuss so many subjects that is related to the family's health care nowadays.
I'm all yours.
Okay, let's start with I think, which is the very most common problem we are having now this season, as we are in the middle of the winter, which is the respiratory diseases.
Yes, so respiratory diseases now, let's say it's the most common problems that face children at the age group of from birth till 4 or 6 years old.
Hmm.
And these symptoms or this disease usually spike during the winter times, and the numbers start to increase in the hospitals and the polyclinics with children who's having cough, fever, sneezing, runny nose, and some of them will have difficulty breathing.
Yeah.
Now in Kuwait, the most common issues that face the families during this winter time is the viral illnesses
Yeah.
that is due to influenza viruses or flu viruses, and most of them are similar in symptoms and signs, but each one would have different difficulties or grades of respiratory difficulties, let's say,
Hmm.
and problem with breathing. So families has to be aware and be ready when their children are having difficulty breathing, and we would try to help them recognize these symptoms in order to take their children to the hospitals when needed.
Well, that's a question. When is the best time to take the children to the hospital if they are having the symptoms?
So, as we said, most of the respiratory problems are similar in character and symptoms.
Hmm.
But when to take the child to the hospital or to the emergency room, there are certain signs that families should look into, and it depends on the age group of the children.
Hmm.
So, if you have a newborn, or let's say in months age, who is dependent only on families feeding them milk or having small eats, so the most important thing that they don't fail breathing. So if they breathe very fast and they cannot have enough rest during the night, this is one of the symptoms or the signs that tells you to take your child to the hospital. One another thing is, if these small children are not getting enough feeds,
Hmm.
they will get dehydrated very soon, and you'll get into another problem more than just a problem of breathing.
Hmm.
Um, Also, if children are fainting, or let's say getting cyanosis, which they get bluish in color because they don't have enough oxygen in their blood. These are one of the important signs that families has to look into and to be aware of them.
Hmm.
And some other things, let's say a very persistent cough that can uh, interrupt their daily activities, or it interrupts their sleep. This is a very important sign also to take your
Well,
child to the.
that's a very nice details you have mentioned. But regarding the sickness or the respiratory problems the children they have, the families always think about the medication and when to start using the medication. Safely, we have the paracetamol, which can be used, I think, immediately if the patient is having a fever. But
Mm,
with the other categories of medications, such as corticosteroids or the beta agonist,
mm,
which
mm.
helps to relax the muscles of the lungs. With the corticosteroids, do you recommend, and we also have the antibiotics as well, but because we have a very limited time, so we need to
Yes.
discuss very quickly each category of them.
Yeah.
So
So
starting with the corticosteroids, what's your opinion of using them?
so corticosteroids, it's a very magical medication that you can use in every single problem in life. And I believe that steroids are very potent and very important weapon that you use to fight these respiratory problems. And with it, when it's indicated. So if a child is known to be asthmatic
Mhm.
and he has bronchospasm or difficulty breathing and cannot be relieved by beta agonists, then corticosteroids is a must.
Mhm.
But if the child is responding well to the regular
Medication.
inhalers or medications, then I don't think that there is a need of.
Mhm.
The other thing is the antibiotics. So most of these problems are viral in nature.
Yes, you have mentioned that before.
So antibiotics wouldn't be of a use in
Mhm.
these situations. But there are certain problems, certain diseases that should be treated with antibiotics. Otherwise, you wouldn't be treating the child well.
Mhm.
And about the paracetamol or the antipyretics, like paracetamol, Brufen,
Classes of
other
NSAIDs.
class of NSAIDs, it's very good to be used when there is a fever, when there is pain, when there is a difficulty or irritability of the child,
Mhm.
and it's somehow safe. So if you have given the child the proper dose, I don't think it's a problem. But
Let's stop for a moment here because we have a very big debate about using the ibuprofen and the paracetamol interchangeably. So, are you a big fan of that or not?
so yeah, this is a technique that has been used for a long time,
Mhm.
where they use the paracetamol, and in another 4 hours you will use the Brufen. It's a good technique, but some children who's having bronchospasm or known to have a wheezy chest or asthma,
Mhm.
it's somehow contraindicated. So
Yes.
I recommend, if you want to use it, at least use it in a safe setting in the
Mhm.
hospital the first. If the child is not having any problems, then you know that this child, even if he's asthmatic, he wouldn't have a problem taking the NSAIDs.
Mhm.
But um, to use it frequently,
You wouldn't recommend it.
I wouldn't recommend
Yeah.
it, but unless
You
it's
should
really
be
recommended.
cautious somehow
You
and
should,
looking
you
for the
should,
other symptoms.
you should, you
Now,
should.
the most important point again is the use of the salbutamol solution as an inhaler or as a for the vaporizer.
Yeah.
Some of them they say that the salbutamol might be addicted. Is that right?
No, that's a big myth that it's it's in our community.
Yeah.
Everyone is afraid of having the nebulizers and inhalers, thinking that their children will be addicted to it.
Mhm.
To be addicted to a substance or a medication, it has to be a class of, let's say, derivative of heroin or cocaine or whatever,
Which is like a
which is
psychotropics or a
exactly,
narcotics.
exactly.
Yeah.
So this class is not one of
Addictable.
them,
Yeah.
and it's not addictable. And even if you use it in a daily basis,
Mhm.
you wouldn't be addicted to it. The need for it, it's a life-saving medication,
Mhm.
and I believe it's a pity that some families are not giving their children this medication,
Yes.
even though they are very well known to have asthma.
Yeah.
And you see their child is suffering, and he's catching his breath and he cannot breathe. And because of the child, if the father or the mother is not allowing it, imagine you see a child coming to the
The
hospital
symptoms
in
might
a
get
very
worse.
bad, and you might admit him to the ICU
Yeah.
because you cannot treat him with the medication that it's everywhere.
Okay, now apart from using the medication, let's have our last question of today's episode. Now, how long would you recommend to keep the child at home if he's having these symptoms so we can at least keep this virus to be spreaded in the school, as example?
So, if the child is, you mean after he's getting
Yeah, if he's having
the
the symptoms
sickness?
and he
Okay.
has been diagnosed with the flu and having a viral infection, let's say, so for how long
So
you
it
would?
depends on the virus,
Yeah.
and you cannot what virus it is unless you do the swab.
Hmm.
So, but in general, if the child is back to his normal self, he's not having fever, and he is eating and drinking
Very well.
enough
Yeah.
very well, then he can go back to school. Some of the children will get well within 3 days.
Hmm.
Some of them needs 2 weeks to get well. So it depends on the patient and how he is behaving afterwards.
Dr. Mohammed, we are so pleased to have you here, and we hopefully have you again and later on.
Thank you very much for having me here, and thank you for the opportunity to be part of this show, and thank you very much.
Thank you for your attendance. Our dear viewers, we have reached to the end of today's segment of Medcast. Please be with us in the next segment. Until that time, with another specialist. See you later. Goodbye.